Although there are many different types of insomnia and treatments, one aspect of sleep, sleep hygiene, is foundational to all types of insomnia. A patient should be educated on sleep hygiene to help improve their sleep if insomnia is a concern. According to the National Sleep Foundation, there are 4 key aspects of sleep hygiene. The bedroom environment should be dark with minimal distractions and set to a cool and comfortable temperature. It's important to maintain a regular sleep schedule. That is, it's important to try to go to bed and wake up around the same time each day if possible. Before going to bed, it may be helpful to have a bedtime routine to help with relaxation, including disconnecting from technology. Daytime habits can also affect sleep, so it's important to be mindful of this. It's recommended to have regular exposure to sunlight and exercise, and avoid smoking and excessive amounts of caffeine and alcohol, which can disrupt the sleep cycle.
Before initiating treatment for insomnia, you may want to consider what specific type of insomnia the patient is experiencing. There are multiple types of insomnia, which are not discussed in detail here, but are classified in the DSM-5 Sleep-Wake Disorders section. This is an example of a treatment order you may see used, especially in the inpatient setting. It can also be helpful to think about any comorbid conditions that the patient has. For example, patients with insomnia and migraines may benefit from a tricyclic antidepressant.
We're not going to go over all of the information listed in the following medication tables right now, but it will be available to you for reference later. There are many different types of medications that can be used to help patients with insomnia, and choosing which specific treatment to initiate may depend on the medication's side effect profile and the patient's comorbid conditions. For example, a patient with depression and associated loss of appetite and insomnia may benefit from low-dose mirtazapine. Quetiapine at lower doses can help with sleep as well. However, at these lower doses, the dopamine blockade is typically not strong enough to treat psychotic symptoms in patients with schizophrenia. Other classes of medications that you may see used for treatment of insomnia include dual orexin receptor antagonists and those that work on GABA. It's important to note that the medications listed here in the GABA category are all scheduled medications and not recommended for patients with history of substance use disorders. Many of these, including zolpidem immediate release and zaloplan, are only indicated for short-term treatment of insomnia.
Again, just like some of the other medications in the previous table, many of the medications listed here that work primarily through H1 antagonism are only indicated for short-term treatment of insomnia due to tolerance that may develop over time. You also may want to exercise caution with some medications, specifically in the geriatric population, such as gabapentin, because this medication can increase risk of falls. There are also some herbal compounds that have been used for insomnia. However, at this time, there's insufficient evidence-based data to confidently support the efficacy of these herbal compounds.